Pathology, to me, is the department that is behind the scenes, giving the doctor an answer as to what is potentially going on with a patient.
The doctor acts as the general of a fairly large army. There's a lot of FaceTime patients get with doctors and nurses, and they never realize how much goes on behind the scenes. Approximately 70% of all diagnoses made by doctors come directly from lab results.
We're the people that run those samples, so we're able to tell the doctor what is wrong with you and potentially how to fix what's wrong.
Anything that makes you sick. We find cancer, we find HIV infection, we find staph infection. If you're feeling sick, what we do is we figure out what's making you sick.
When people come in the door here at our lab or any one of our labs, we've already gotten orders from doctors. What makes my day rewarding is just knowing that what I'm doing is going to help somebody else.
To them, this one blood draw could change their whole world. This could mean whatever disease they've been battling, this is the test that's going to tell them, is it still there or not? Every now and then you have to step back and just try to think of what the patient's going through. Try to treat every experience with, this is a new patient, this is a new story, let me see what her story is or his story, and put yourself in their shoes.
It took me a while, to just say, you have cancer. Sometimes it just overwhelms me, I want to just tell them how important their work is. Do you realize the people that you help, you're a part of the puzzle that goes together to help people extend their life, Do you think about that every day, how many people you help?
I work in hematology. That works with the formed elements of blood, red blood cells, white blood cells, and platelets. The morphology helps the doctors indicate exactly what's going on in the patient.
One of the things that distinguishes our lab is the amount of instrumentation that we have and how big it really is and how many patients it works on per hour.
It is a literal 24/7 job. We have multiple shifts that cover all 24 hours of every day. We work weekends, we work holidays. Patient care does not stop.
I find the whole job rewarding. I love everything that I do. There's a patient at the end of that tube. There's a patient at the end of that order number. And my job that day is helping make sure that they're getting the diagnosis that they need, that they're getting the treatment that they need, and that we're helping the doctor catch anything that could possibly be wrong.
Hundreds of us here in the laboratory all care, and we're all working to achieve the best patient care that we can give. And that's what I would like patients to know.
There are about 30 couriers who drive for UR Medicine Labs, and we're always on the go. It's up to us to have their specimens delivered at a certain time. The quicker we get it, the faster they know their results. To me, that's important.
In a typical day, I review hundreds of slides from dozens of different patients, and only very rarely do I receive any follow-up about what happens to those patients. One time I did receive a letter from a patient. It meant the world to me. I am writing to thank you for all your careful work evaluating my colon cancer last month. While I have had multiple doctors helping me since last month, you are the only one I never met. Yet you are among the most important. I am most grateful for your attention to detail. Thank you very much.
I always try to remember that there is a face behind the sample, there is a family, there is a person who needs this result, and that's what drives me to go.
Analyzers and computers simply cannot keep up with the abnormalities found in these diseases. So without us, a lot of that treatment would just be guessing.
Cancer is relentless, like they say on TV, but so are human beings. I'm clear now. It's a possibility it could come back, but we'll handle that when it comes, if it does. What do I say to all the people that work so hard to get everything right so that I could have a longer life? It seems impossible just to say thank you, but one gentleman said, well, I think that they want you to be well and they want you to live your life.
If anybody has even an inkling of an interest in the medical laboratory field, I absolutely love the choice that I made. I love what I do every day, and I love that my job is incredibly important to the well-being of patients.